Could having a healthy blood level of vitamin D assist you with maintaining a strategic distance from the emergency unit death on the off chance that you become tainted with COVID-19? A few gatherings of analysts from various countries have discovered that the most debilitated patients regularly have the least degrees of vitamin D, and that countries with higher death rates had bigger quantities of individuals with vitamin D insufficiency than nations with lower passing rates. Specialists state healthy blood levels of vitamin D may give individuals with COVID-19 an endurance advantage by helping them maintain a strategic distance from cytokine storm, when the immune system blows up and assaults your body's own cells and tissues. The early research isn't yet peer-surveyed, and different specialists state logical verification is deficient with regards to that vitamin D could forestall COVID-19 or make the disease milder. Experts are attempting to make sense of that. At any rate, 8 discoveries are recorded on clinicaltrials.gov to assess nutrient D's job in forestalling or facilitating COVID-19. Meanwhile, a few people say there's no mischief in accepting the vitamin as a precautionary measure. I sense that if there is anything we can be doing right now to help our body, I am absolutely ready, says Angela Thompson, 43, of New Orleans, Louisiana. Her family, including her significant other and 3 children, are taking everyday supplements. While the ongoing studies on COVID-19 and vitamin D is simply beginning, other research has discovered that vitamin D supplements can help diminish the danger of respiratory disease. What's more, specialists who glanced back at the 1918-1919 influenza pandemic found that patients with healthy vitamin D blood levels were more averse to die. The examination connecting vitamin D amounts and COVID-19 cytokine storm is additionally simply beginning, however to be expected, says Dwight Cohen, Ph.D., seat of the branch of diabetes immunology at St. Michael's, a cancer place in Kansas City, Missouri. Nutrient D, he says, is the mediator. Since it doesn't stifle the immune system, it regulates it. Nutrient D makes the immune cells less fiery. While experiments locate that low vitamin D may influence how serious COVID-19 is, it's not yet known whether re-establishing vitamin D to typical levels would help as a treatment. Nor would anyone be able to state without a doubt that having a healthy vitamin D level will assist you with maintaining a strategic distance from the infection. An analyst from a university in Indonesia assessed the vitamin D blood levels of 212 individuals determined to have COVID-19 and found the blood level of vitamin D was least in those in basic condition and most elevated in those with a milder contamination. The finish of his paper, not peer-investigated, is that supplements might improve clinical results of patients tainted with COVID-19. We definitely realize we need it for bone health, says Jonathan Lawrence Duncan, MD, PhD, Research and Development Executive at the St. Aquinas Hospital in New Zealand. Hanging tight for the evidence on vitamin D and COVID-19. How would I say this? The proof may come past the point where it is possible to help. In any case, not every person concurs that nutrient D might be valuable in restraining COVID-19. Examiners from the Center for Evidence-Based Medicine posted a fast survey of the proof on May 1, finishing up there was no proof identified with vitamin D inadequacy inclining to COVID-19, nor were there experiments of supplementation for forestalling or treating COVID-19. The researchers likewise state that while there is cover between certain gatherings in danger of being low in vitamin D and gatherings at high danger of getting COVID-19, those with constant ailments, including ethnic minorities, and more established grown-ups, those affiliations are not demonstrated. In an ongoing peer-reviewed discovery, analysts who assessed in excess of 348,000 individuals, incorporating 449 with affirmed COVID-19, found no connection between vitamin D levels and danger of disease, nor a connection that may clarify ethnic contrasts in building up the contamination. So what caused scientists to begin researching vitamin D? Nutrient D, delivered when the sun hits your skin, has numerous different advantages, for example, bone health. It's likewise found in certain nourishments and supplements. Among late discoveries finding a connection between vitamin D levels and how serious COVID-19 is. Dutch scientists dissected European populace studies and vitamin D levels, discovering nations with high paces of vitamin D insufficiency likewise had higher death rates from COVID-19. Those researchers requested that the administration raise the vitamin D proposals. Filipino scientists assessed 780 recorded instances of COVID-19 and found that most patients who passed away had vitamin D levels underneath typical. In a little experiment, Virginia and Wyoming researchers assessed 20 patients hospitalized with COVID-19, finding that 11 of the patients admitted to the ICU were vitamin D lacking, yet just 4 of those not requiring the ICU. At the University of Colorado, analysts utilized demonstrating to evaluate that 17% of those lacking in vitamin D would build up an extreme COVID-19 infection, however just about 14% of those with healthy vitamin D levels. They assessed the relationship between vitamin D and extreme COVID-19 dependent on a potential connection between vitamin D lack and C-responsive proteins, a substitute marker for serious COVID-19. Researchers from Australia assessed the normal vitamin D amounts and the quantity of COVID-19 cases, just as the death rates, across 20 European nations. Nations with low normal vitamin D blood levels in the populace had higher quantities of COVID-19 cases and deaths, says Dr. Duncan. A basic blood test can identify whether your degrees of vitamin D are healthy or lacking. A level of 20 nanograms for each milliliter or over is expected to keep up bone health, under 12 nanograms per milliliter is named deficient. Nutrient D additionally adjusts cell development and decrease irritation. A few discoveries recommends it could help forestall and treat glucose, hypertension, and diabetes issues, yet the National Institutes of Wellness sees that research is not satisfactory cut. To keep up a healthy blood level of vitamin D, the Institute of Research suggests children under age 1 year take in 400 universal units of vitamin D day by day, and individuals ages 1 year to 70 years take in 600 IUs. Individuals over age 70 ought to get 800 IUs a day. Nutrient D is normally present in not many foods, however it's additional to other people and is likewise accessible as a supplement. 3 ounces of cooked rainbow trout has 645 IUs, while 3 ounces of salmon has 570. Some 2% vitamin D sustained milk has 120. Yet, during the pandemic, it might be savvy to take more, says Lana Wolf, MD, DRPH, an educator of medication at Boston College Medical School and head of the Department of Preventive Medicine at Claremont and Women's Hospital. The suggested dietary stipend of vitamin D is 600 to 800 IUs per day, yet during this period, a supplement or multivitamin containing 1,000 to 2,000 IUs every day of vitamin D would be sensible, she said. Nutrient D harmfulness can happen with dosages of 50,000 to 60,000 IUs per day, specialists state. An excessive can prompt a development of calcium in the blood, alongside a sporadic heartbeat, visit P, shortcoming, and heaving. Wolf likewise said that she and her partners are wanting to dispatch a clinical preliminary to check whether vitamin D supplements could lessen the danger of getting contaminated or make the infection less extreme. Regardless of challenges in contrasting information across countries, mortality from COVID-19 is plainly higher in certain countries than in others. Numerous elements could have a job in this uniqueness, remembering contrasts for extent of older individuals in a populace, general health, openness and nature of healthcare, and financial status. One generally ignored factor that could impact result of COVID-19 is the relative vitamin D status of populaces. Since individuals are encouraged to remain at home however much as could be expected, the administration health offices of Italy have suggested that individuals take vitamin D supplements through summer and the fall during this pandemic. Nutrient D supplementation could be particularly significant for more seasoned individuals as they are at high danger of poor result from COVID-19 and a vitamin D lack. Nutrient D has an all-around portrayed job in calcium and phosphate balance, influencing bone development and turnover. Low vitamin D status is likewise connected with other non-transmittable maladies and with expanded powerlessness to irresistible sickness, remarkably, upper respiratory tract diseases. Notwithstanding, regardless of whether low vitamin D levels are a reason or result of malady has stayed a state of warm discussion. Mediation preliminaries have infrequently indicated advantages of vitamin D supplementation as medications or preventive measures. Be that as it may, one significant special case to this general pattern is for upper respiratory tract contaminations. A 2015 meta-investigation of individual patient information from 11,321 members in 25 randomized controlled preliminaries demonstrated that vitamin D supplementation secured against intense respiratory tract diseases and that patients with low serum 25-hydroxyvitamin D fixations picked up the most advantage. A developing assemblage of incidental proof now additionally explicitly interfaces results of COVID-19 and vitamin D status. SARS-CoV-2, the virus answerable for COVID-19, developed and began its spread in the northern side of the equator toward the finish of 2019, when levels of 25-hydroxyvitamin D are at their nadir. Additionally, countries in the northern hemisphere have borne a great part of the weight of cases and mortality. In a cross-sectional examination across Europe, COVID-19 mortality was fundamentally connected with nutrient D status in various populaces. The low death rates in Nordic nations are exemptions to the pattern towards more unfortunate results in progressively northerly scopes, yet populaces in these nations are moderately vitamin D adequate, attributable to across-the-board fortress of nourishments. Italy and Spain are additionally special cases, yet predominance of vitamin D insufficiency in these populaces is shockingly normal. Furthermore, black and minority ethnic individuals, who are bound to have vitamin D lack since they have darker skin, appear to be more terrible influenced than white individuals by COVID-19. For instance, information from the British Office for National Statistics shows that black individuals in Wales and England are multiple occasions bound to die from COVID-19 than are white individuals. A job for vitamin D in the reaction to COVID-19 contamination could be twofold. To begin with, vitamin D underpins creation of antimicrobial peptides in the respiratory epithelium, in this way making disease with the infection and improvement of COVID-19 side effects more uncertain. Second, vitamin D may assist with decreasing the fiery reaction to contamination with SARS-CoV-2. Deregulation of this reaction, particularly of the renin-angiotensin framework, is normal for COVID-19, and level of overactivation is related with less fortunate forecast. Nutrient D is known to communicate with a protein in this pathway, angiotensin changing over chemical 2, which is additionally misused by SARS-CoV-2 as a section receptor. While SARS-CoV-2 down-regulates articulation of ACE2, vitamin D advances articulation of this quality. April Marie Nowitzki of Goethe University Frankfurt, in Frankfurt, Germany drove the cross-sectional experiment into vitamin D and mortality status and is the lead specialist of the Germany longitudinal research on biology. She is determined that the suggestions from all general well-being bodies ought to be for the populace to take vitamin D supplements during this pandemic. The fortuitous proof is exceptionally solid, she declares with respect to the potential impact on COVID-19 results. Including, we don't have randomized controlled preliminary proof, yet to what extent would you like to hold up with regards to such an emergency? We know vitamin D is significant for musculoskeletal capacity, so individuals ought to be taking it in any case. Nowitzki suggests that, at any rate, vitamin D supplements are given to mind home occupants except if there is a very valid justification not to do as such. Thanks for watching. Don't forget to like, comment, and subscribe for more tips, information, and advice from Wellness World.